Never run out of battery again with the INIU portable charger, the slimmest 10,000 milliamp hour power bank that keeps your devices charged on the go. Stay powered up wherever you go. Click the link in the video description to shop now on Amazon.
Hard to spot cancer that can go undetected for months or even years. The public is being warned to be on the lookout for subtle signs of a rare cancer type that can go unnoticed for extended periods. Papillary thyroid cancer, the most prevalent form of thyroid malignancy, is known for its slow progression, often eluding detection due to a lack of clear symptoms in the initial stages. Papillary thyroid cancer is usually only discovered incidentally during routine medical examinations or while investigating other health issues. Experts at the MD Anderson Cancer Center highlight that individuals with papillary thyroid cancer often have symptoms that they dismiss for years until receiving a diagnosis. The organization notes that while this type is the most common and least aggressive, other thyroid cancers like anaplastic or poorly differentiated variants are far more severe. Papillary thyroid cancer typically develops slowly in one or both lobes of the thyroid gland. The organization emphasizes patients diagnosed with papillary thyroid cancer often have symptoms that they dismiss for years until receiving a diagnosis. As reported by Surrey Live, signs to watch for include. In contrast, rarer and more aggressive thyroid cancers, such as anaplastic thyroid cancer or poorly differentiated thyroid cancer, present more abruptly, often as a large lump that emerges over weeks or months. A study by the University of Aberdeen has uncovered that it typically takes around 4.5 years to diagnose a thyroid condition, with those suffering from hypothyroidism facing even longer delays. Almost 2/3 of participants revealed they required multiple appointments and experienced worsening symptoms before receiving a diagnosis. The NHS categorizes thyroid cancer as a rare form of cancer, making up less than 1% of all cancer cases in the UK. The Health Service states, it's most common in people aged 35 to 39 years and in those aged 70 years or over. Women are 2 to 3 times more likely to develop thyroid cancer than men. Identifying thyroid cancer can be a complex process. Symptoms are often vague and can mimic those of other, less serious illnesses, meaning you could unknowingly have thyroid cancer for months or even years. Our community members are treated to special offers, promotions, and adverts from us and our partners. You can check out at any time. Read our privacy policy. We use your sign-up to provide content in ways you've consented to and to improve our understanding of you. This may include adverts from us and third parties based on our understanding. You can unsubscribe at any time. Read our privacy policy. This cancer type originates in the thyroid gland, located at the lower part of your neck, just beneath the voice box and above the windpipe. The thyroid is vital in our bodies, producing and releasing hormones that aid digestion and support heart and muscle health. It generates 3 primary hormones: triiodothyronine, T3, thyroxine, T4, and calcitonin. A series of tests are typically conducted to identify thyroid cancer. If cancer is found, these tests will aid your doctor in deciding the best course of treatment. The tests may include. According to the NHS, this type of cancer is relatively rare and tends to affect women more than men. In fact, women are 2 to 3 times more likely to be diagnosed with thyroid cancer compared to men. The reasons for this gender disparity remain unclear, but it could be related to hormonal changes within the female reproductive system. The most common symptoms include. Other symptoms can include. Thyroid cancer can affect anyone, and its exact causes are often unknown. However, certain lifestyle factors may increase your risk. You might be at a higher risk if. Papillary thyroid cancer is the most common form. The specific type of thyroid cancer is determined by the cell from which the cancer originates. There are several types of thyroid cancer, including. While thyroid cancer prevention isn't always feasible, adopting healthier lifestyle choices can help lower your risk of developing it and other types of cancer. This could involve shedding excess weight if you're overweight, restricting your alcohol consumption to a maximum of 14 units weekly, and giving up smoking. It's crucial to have any potential symptoms of thyroid cancer examined by a GP. For further information and assistance, visit the NHS website or the British Thyroid Foundation website. Macmillan Cancer Support operates a free helpline open daily from 8 a.m. to 8 p.m. They're available to listen if you need someone to talk to. Call 808-800-800. If your GP refers you to a specialist, you may need additional tests and scans to explore the likelihood of thyroid cancer. These tests might include blood tests, a neck ultrasound, and a biopsy, which involves using a needle to extract a small sample from your thyroid gland for cancer examination. However, bear in mind that not all these tests may be necessary. Your test results may take up to 2 weeks to come through. If the wait is causing you anxiety, try to remain calm. A delay doesn't automatically mean there's an issue. If you're worried, reach out to the hospital or your GP for an update. A specialist will go over your results with you and discuss the next steps. It could be beneficial to bring along a friend or family member for support. The main approach to treatment is surgery, which can either involve taking out just the affected lobe, known as lobectomy or partial thyroidectomy, or the complete thyroid gland total thyroidectomy. After surgery, radioactive iodine therapy might also be utilized. Papillary thyroid carcinoma, PTC, is highly treatable and seldom leads to death, boasting an excellent survival rate.